So the recording has started. I think.
Can I just say one thing as well, real quick, before you start?
Yeah.
Real quickly. There's another. I don't think he's on. I had some contact with our colleague that's part of the organizing the journal clubs, Mehdi, who is in Iran. Yeah. He sends his regards.
Okay, great. Thank you so much.
And he's safe, but obviously the situation there does not allow him regular internet access.
Oh no, I know, it's a shame. We've it's really a bad situation, and I'm very grateful that Maddie was from time to time able to connect, but our thoughts are also with him. Yeah. Maybe so we can then, I think, afterwards start with the meeting, because we would like to keep it always to an hour, so that people also know up front how long they can expect this meeting to last. For everyone that is new here, this journal club is organized from the International Community for AI in MS, which started last year and is actually getting a lot of enthusiastic members that are joining our community. So you yourself are also very welcome to join us. So we have a website, iAIMS.org. So please visit it, and you will be kept up to speed with all our new developments. That being said, again, the meeting is going to be recorded, and we will put it on YouTube afterwards on our YouTube channel. Just for the little code of conduct here, it would be great if you are in the, if you can do so, to put your video on so that we can see you, your camera. That gives a bit of inclusivity in these digital meetings. And that being said, I think it's time for me to start introducing Joke. By the end of this meeting, don't forget maybe to also fill in a Google Forms. So on the events page within our community, there is a little link, and then we can actually improve our journal clubs in the future. But I'm going to repeat that at the end of the meeting so that everyone knows. So that being said, it's my pleasure to introduce Joke Soetaert. So Joke is actually a patient expert who's also associated to the MS, not the MS League, but the MS Society of Flanders. And Joke is here today to actually take the perspective of patients and what their attitude and their needs with regards to artificial intelligence are. So I think that's a very interesting new perspective, in the sense that we are often creating tools together, like caregivers and AI developers. And I think it would be really good to know what they have to say. So I will leave the floor for Joke from her patient expert perspective. The floor is yours.
Thank you so much, Steen. Hello, everyone. Is everything working well? Does everyone hear me? Sees the screen? Yes. Okay. So welcome to this journal club. When we talk about AI in MS care, we often talk about technology, but today I want to talk about people. And it all started almost a year ago. I met Steen at a local event for MS nurses in Belgium, and he gave a presentation about AI in MS care, and afterwards we started talking. A few months later, I found myself in the audience again, this time at iAIMS in Barcelona. It was another session for MS nurses, where Steen shared insights from the Flemish MS community. I was listening with two perspectives, as a healthcare professional and as someone living with MS. And after that session, I invited Steen to speak at our annual youth conference for people with MS. And during that collaboration, he told me about iAIMS, and eventually that led to this invitation to this journal club. I'm truly happy and honored to be here. It really means a lot that you want to understand how people living with MS feel about AI. So thank you for spending your Friday afternoon with me, and for some of you, maybe at the other side of the world, a very early Friday morning. Let's get starting. A short introduction about me. I work full-time as a midwife in a hospital. I was diagnosed with MS in 2019. I coordinate the youth program within our national MS organization as a volunteer. And for the past 4 years, I've also been active as a patient expert nationally and internationally. When preparing for this session, I knew I didn't want to just share my own opinion. I wanted to understand how other people with MS feel about AI. So before starting my research on AI and MS, I first brainstormed with my AI assistant, Lex. By the way, he chose the name Lex himself, which stands for knowledge. So after a brainstorm session together, I asked Lex to help me design a survey for people living with MS. Because if we are going to talk about AI and MS care, the key question is not only what the algorithm can do, but what people living with MS actually want it to do. Before we look at the results, I want to briefly zoom out for a moment. There is quite a lot of scientific research on AI and MS. Most studies focus on how AI can help physicians, for example, analyzing MRI scans or predicting disease progression. But much less research looks at AI from the perspective of people living with MS themselves. One interesting recent perspective paper published in the journal Frontiers in Immunology, led by Anne Helme and colleagues, highlights exactly this point. The authors argue that AI and MS should not only be developed for patients, but with them. And they emphasize the importance of including patient-reported outcomes, or PROs, lived experience, and patient input when designing AI tools for healthcare. In other words, technology may be powerful, but if it does not reflect the real needs and concerns of people living with MS, its impact will remain limited. And that is exactly why I wanted to start by asking people with MS themselves. Now, I want to pause for another minute. If you had MS and tomorrow your neurologist told you the AI model suggests that this treatment for you based on your prognosis, would you feel reassured or uneasy? Hold that thought as we go through the survey responses, because behind every dataset there is a person, and behind every prediction there is a life. So we distribute a short survey through our national MS organization and through our youth working group, and 93 people with MS responded. The majority of respondents were aged 30 or older. And as we also see in multiple sclerosis in general, the large majority of participants were female, with more than 80% identifying as women. Around 75% of respondents had a higher education background. And one finding that stood out to us was how recently many people had been diagnosed. About 1/5 received their diagnosis last year or even this year, and about 1/3 within the past 6 years. This means we mainly reached people who were relatively recently diagnosed. Let's first look at AI in daily life with MS. Regarding AI use, 73% of participants already use AI tools. Within this group, about 30% reported that they feel very familiar or comfortable using them. We were actually very pleased to see that we were also able to reach people who are not yet using AI, which represents about 27% of the respondents. More than half of the participants said they are very interested in using AI to obtain reliable information about MS. And we also explored how AI could potentially support them in their daily lives in relation to MS. The most frequently mentioned use was obtaining medical information about MS. In addition, many respondents mentioned topics that people with MS often have questions about and that we know can have a significant impact on the disease and on the symptoms, besides medication. These included physical activity, energy management, nutrition, stress management, and mental health. More than 40 respondents said they would use AI to look up scientific research. And interestingly, several organizations are currently working on platforms, also with AI, that make it easier for patients and for healthcare professionals to find clinical studies. Many also indicated that they would use it to prepare for consultations with healthcare professionals, for example, by helping them generate a list of questions in advance. And about 1 in 5 respondents also saw opportunities to use AI to connect with peers or peer support groups. We also asked how important it is for them that a human remains involved when AI is used for daily decisions. Almost half of the respondents felt that a human should always be involved, while the other half said that it depends on the situation. Not every decision has major implications. For example, if AI suggests a physical activity plan, people might simply try it out and see how it works for them. In that sense, the importance of human involvement can depend on the context. And finally, we included an open question asking how AI could better support them in their daily lives as a person with MS. The results are shown here as a word cloud. The larger the word, the more often it was mentioned. Many respondents said they were not sure yet. Some were also quite critical and indicated that they do not fully trust AI. However, several themes came back that we already saw earlier, such as stress management and access to information. Respondents particularly appreciated the idea of having 24/7 access to answers, even when their healthcare professional is not immediately available. Other suggestions included tracking symptoms through apps and receiving support with administrative tasks. Overall, many respondents seemed to see AI as a kind of coach, advisor, or buddy that could provide personalized guidance. And one person also mentioned that it could be helpful if certain daily tasks could be automated in order to save time and energy. The second part of the survey focused specifically on the use of AI in healthcare, particularly in hospitals and in interactions with the physicians. More than half of the respondents, AI in healthcare mainly triggered feelings of curiosity, and many also reported a sense of hope. A smaller group expressed some distrust, bit of fear, or indifference. We then asked whether they would feel comfortable if AI helped to make decisions about their MS treatment. Interestingly, no one selected yes completely. However, more than half of the respondents said they would be open to it as long as their physician remains ultimately responsible for the final decision. About 28% said they were unsure, and 80% indicated that they would not feel comfortable with AI helping to decide on their treatment. And I must say that result surprised me. My assumption is that this may partly come from unfamiliarity with how AI could be used in this context. For example, if robust prognostic tools are developed where physicians can enter multiple clinical parameters, AI will likely play a role in analyzing that information. And such tools could potentially have significant value in supporting personalized treatment choices and aiming for the best possible outcomes. I also expect that these perceptions may evolve over the coming years as people become more familiar with the potential benefits of AI in healthcare. We also asked respondents about several possible applications of AI in MS care. When concrete examples were provided, about half of the respondents believed AI could contribute to better outcomes, for example, by improving the prediction of relapses or disease progression. And many also saw potential value in areas such as MRI analysis, personalized treatment approaches, reducing administrative burden, and monitoring symptoms through apps. And some respondents also mentioned the possibility of enabling a faster diagnosis. Still, around 10 respondents indicated that they currently see no added value of AI in the medical management of their MS. And then we asked the respondents all about their main concerns regarding the use of AI in healthcare. Around 60% were worried about incorrect decisions and about possibility of losing human contact in healthcare. About half of the respondents were also concerned about privacy. And in addition, some people feared that patients might become less involved in their own care if AI is used more widely. At the same time, a small number of respondents indicated that they had no particular concerns about AI in healthcare. To conclude the survey, we asked an open question again about what role AI could potentially play in their MS care. As you can see in the word cloud, the most prominent theme was information. Other themes that appeared again were better MRI analysis, administrative support, symptom monitoring, and potential support for managing side effects. Some respondents also mentioned the possibility of faster and more accurate diagnosis, more personalized care, and improved prognosis. Several people also saw AI as a support tool for physicians. And interestingly, a number of respondents described AI mainly as an advisor, a tool that provides information and insights so that they themselves can make more informed decisions together with their doctor and MS nurse. At the same time, not everyone was convinced. Some respondents felt that AI might not have much to contribute. One person even wrote as little as possible, and another simply answered nothing. So, what are the conclusions of this survey? It shows that younger participants are more curious and open-minded towards AI, seeing its potential mainly for practical and informational support. Older participants are more cautious, emphasizing human oversight and privacy. Women tend to be more active users or interested in AI, while men are slightly more reserved, though concerns are similar for both. Higher educated participants show more understanding of AI applications, while lower educated participants are generally more cautious. Also, an interesting insight is that people diagnosed more recently, almost always under 40 years of age, are especially curious and eager to use AI for daily support, while those diagnosed longer ago are more cautious. Overall, AI is seen as a supportive tool, not a replacement, with curiosity, hope, and caution across all groups, and they clearly still value human involvement and want to remain active participants in decisions about their health. Thank you so much for listening. I would love to open the discussion. I'm very curious to hear how you see the role of AI in MS care from your own perspective. And if you have any questions, I will try to answer them myself. And otherwise, I might ask my ChatGPT friend Lex for help.
All right.
Thank you so much.
Thank you, Joke. That was really well prepared. Thank you for taking the time.
Thank you for listening. I see a lot of familiar faces now. Nice to see you all. Yeah.
Yeah, so maybe I can open the discussion here a bit. So first of all, Joke, apart from the preparation that was really in depth, I think you touched upon a lot of relevant points, and actually it's really cool to see such a. I think it's the first time I actually see such an elaborate analysis of how patients think about AI in MS care. And so I think we can just open the discussion. I can start maybe the discussion with a little question. And then afterwards, I would invite everyone just to chime in. Maybe raise your hand so I can keep track of who was first, and then just moderate the discussion a bit. But please feel free. It's a very open-minded community and an open-minded discussion. So please share your thoughts with us. I was just wondering, maybe, Joke, what do you observe as the way forward now? Because for those patients with MS, some indicated like, I don't know, or I don't care, I don't want to know. Do you think that it's our job to actually convince them to think otherwise? Or do you think like, maybe there is not everyone would like to have AI in their MS care, it should be more personally tailored? And what do you think we can do better to actually involve AI patients with MS in this AI discussion?
Well, thank you for your question. I think that will come by time. It needs a lot of time. I think if you took this survey like 5 or 10 years ago, the number of people who are not feeling comfortable with it or are even against it are much higher. So I'm also surprised that I think in a lot of things, like in research or in MRI analysis, they already use a lot of AI and nobody knows.
Yeah, that's actually something I was surprised to see, that patients, for example, knew that MRI analysis once was one of the things that AI was used for. It somehow maybe surprised me, or that maybe physicians tell patients that they use AI to actually do segmentations, for example. Yeah. Maybe I can give the word to Mike in response to that, Joke, unless you have something.
No.
Thanks, Joke. That was a really nice presentation, and
thank you
I think
so
really
much.
very important for us on the research side to hear the to just echo Stein's such a quantitative and meticulous review of patient perspectives on this, so that we all kind of align. I guess one question I have is, there's a lot of work on kind of understanding transparency of these algorithms, like how are they making these predictions and stuff. But one thing that seems interesting is almost every patient for you is saying, I don't want the algorithm to do it independently anyway. I want oversight. I want a doctor to look at this. So I guess, how important is that transparency of the algorithm itself from the patient perspective if it's always having human oversight anyway? Does that make sense as a question?
Yes, I understand your question. Thank you. I don't think that's really what people with MS need. I think it's better to go for a way where the doctor or the MS nurse explains, like, we are now we have now a trial with AI and MRI, or we're in prediction the prognosis, and we are testing it. So I always check it, and we see how it works and how good it is, and then the trust will come.
So it's more important to you. It
seems
more important that it's accurate than that it's fully explainable per se. You'd be happy to have kind of an oracle that just gives right answers.
Yeah, or maybe that the explanations are then not directly for the patients, but that they are somehow filtered or buffered through this view of a doctor and a nurse, if I understand correctly. So say that AI is involved in the care trajectory, that at least doctors and nurses and other care personnel are like technologically literate enough to actually know what it means, and then actually being able to communicate to the patient. Or I don't know whether that's also a perspective, or that we indeed say altogether like this AI is not going to help us.
Yeah, and I also think in my opinion, like for example, with MRI analysis, it is definitely better than a human eye in a lot of things. So we just have to prove it, and then it will come in 5 or 10 years. It will be totally different, I think. Also, a lot of physicians and healthcare professionals are not believing in it, in the AI, and when that shift will come, the patients will follow, I think.
If there's no other hands, can I ask another question? I don't want to monopolize, but so one thing we find is that these AI algorithms are really data hungry. They need so much data, and so I saw one of the concerns was privacy, but it didn't seem to be like a huge concern. So I guess to ask a completely selfish and greedy question, how can we convince more and more patients to share their data, with AI development in these kind of international collaborations and settings? If we could get a huge amount of data, I think that's one of the things that would really help AI a lot. So is there a good way for us to kind of communicate that better to patients, or to work with patients to get that data sharing?
I think indeed the data is not the real problem, or the real concern for privacy, because how I feel it as a patient, you don't have privacy. Everything is discussed with other people next to it, or with other doctors. You don't have privacy at all when you are in a hospital. So I think that's why the numbers are quite low. And how we could even lower them, to just explain it, tell them that it's like with research, it's anonymized. Yeah.
Okay. Thanks again so much for a really
It's
inspiring
also
talk.
in my hospital, when I have an MRI, I have to fill in a list in advance with my weight and details, and I also have to fill in a checkbox that that the images can be used for things like that.
But I think that's just, if I can continue on that trend about data sharing and because, for example, I remember I had another talk with Anthony Travelsey from Canada, who was actually saying that he was super willing to, and I think then also his patients were very willing to share the data, but then that ethical approval and stuff like that actually precluded him from doing so. So it's also for me. I kind of in general have the feeling that patients in MS are very willing to share their data for research endeavors, but that there is maybe regulatory, we're just not ready for it. How do you see that, Joke? And then also looking at other people in the call that maybe have because I see Piet also a lot of
I was also looking at Piet. I give you the word, Piet.
Yeah, no, just I do recognize your remark that working as a nurse and worked in research, that patients are eager to give information, to give data, and to participate in studies, and knowing that results can be used for, well, especially concerning that study, of course. And maybe it could be interesting that all those information could be put together, of course, because all the information from one study is just kept in that study. And there are so many studies and so much more information. And also, of course, all the databases that we use in the different countries, from Scandinavia, in our countries, in France, but of course also in the States and Canada and Australia. And that connection between all those databases could be interesting.
Mm-hmm. Yeah, what I tend to still observe, but maybe I'm still, and I think that's also something that I've maybe repeated over time already, and that I'm kind of getting falling behind in that regard. But I have a feeling sometimes that So there is a big willingness to share that data, but on the other hand, we don't really, okay, you see the data sharing initiatives like MS Base, there is also these other MS initiatives that actually collect their data and you can apply for it and then you can use it for research endeavors. I think in the claims network, there's also something emerging now. So there is definitely an awareness. And still, for example, if you go to Alzheimer's research, there are big initiatives like APNI that actually have a very easy portal for easy sharing and actually open source sharing of that data. And that's still, I don't want to keep pledging for open science, but it's somehow for me a question like where does it go wrong? So how can we make the acuity for AI research bigger if patients with MS are so eager to share their data for research purposes? How can we just facilitate this process? But it's an open question.
I think we are taking steps already with that because we are now working hard, or they are now working hard on the registries, and then I think it will come. But I can imagine that in other diseases, it's already a lot better organized.
Yeah, just maybe we can learn from those initiatives as well, and there are many things that we can.
I want to echo what Stein said about that. There's with talking with Anthony from Vancouver that we've seen the same sort of thing that maybe I asked the wrong question, and as you're saying, most people with MS are very willing to share their data, and we have a data set. We have a registry program internally with 1,000 people or so who have all said they've signed a consent that says I want my data shared universally for everything historically and prospectively. And yet our IRB, our ethics institution, and that's their position, is they're supposed to safeguard things, but they still want to approve every single individual study that uses that data, even though the patients have said, I want my data used. So I guess the question for you guys is there a place for some kind of position paper that would help guide ethics committees a little bit more? Stop standing in the way of me sharing my data or something. Is that something that would be of interest to the community to put together?
Yeah, and that would require co-authorship from the IRB itself, I think.
Yes, but and some patient representatives, and I'm not suggesting to stop safeguarding the data. It needs to be safeguarded. It's vital, but there's probably some balance there for people who want their data to be shared, to not have this administrative red tape over a lot of it that prevents the kind of data sharing that we want to do.
Good point.
Yeah, of course, data is power, of course, and then from it's not only the physicians, but it's also the pharma industry, I think. They have the data, so they know something, and maybe they don't like to share it, and that's why it's so protected, of course. And otherwise, of course, the regulations is we want to protect the people, we want to protect the patient, that they're not bothered constantly by companies or by other studies, and that's why there is the data protection, of course, I think. But yeah, it's so important to have the data sharing in some way.
That's true.
Yeah, it's so in our practice also, when you have the results of a study, then you know that 3,000 patients, when 1,500 were in the intervention group and 1,500 in the control group, and they have those and those and those results. And then, okay, you start a patient on a specific drug, and another one, and another one, and then you have like 3 patients with a negative result, and that's most important experience for yourself, and you don't want to use that drug anymore. At the contrary, in the study, there were so many positive results. But the own expertise is so important, and but I think we have to convince everybody that huge data is more important.
Yeah, personally, I also think sometimes it's a matter of incentive. I was talking with Tommy the other day from our community, and we were discussing, like, wouldn't it be cool if we from the community could actually kind of have come some kind of ceremony where we award some prizes. For example, for a person that has really has actually contributed to open data sharing, or has delivered a beautiful GitHub repository, or whatever. But just because you say data is power, yes. And why is data often power? Because those bigger data sets lead to bigger publications, and there are many other incentives. Well, I think there are other incentives in that classical way of valuing research. And I also think that there is like a place for us maybe to start advocating that we can also that we can celebrate researchers or other people that actually did some kind of did some good work in that regard. So maybe I'm not sure whether I'm expressing myself very clearly, but it's for me also like a matter of incentive, not only like why would you share your data in the first place? Like a researcher, why would a researcher put the entire data set open source online if that means that research questions that the researchers themselves have might be answered by another one because they also have access to that data set. So that's kind of a twisted thing. So, yeah. But just maybe to open the discussion again, then in another regard. So Piet, for example, and I have been discussing some other event that is actually going to be hosted in Belgium. Also, again, we're going to try to work towards solidifying what the patient perspective is on artificial intelligence. Like maybe your vision, Joke, what as a community can we do to also make this more prominent, and to, for example, give more voice to that, because we are obviously mostly researchers, clinicians, and we're very glad that you're now also part of the community. But like, what can we do to just make it more inclusive, and that people know, and that next time they see this survey, they at least don't have to fill in, I don't know about AI.
I think the last few months, or maybe like the last year, it's really a hot topic. Like it started what I said at the coast side of Belgium, at the MS Nurse meeting. And then at ACTRIMS, you had the session on the evening before the event, where I was not participating. And then you had your session. And then we, a few weeks ago, there was a pharma that organized a workshop, a whole day about AI. And then we have this, then we have the brainstorm thing and meetup, like with patients and with researchers in April in Brussels. So in this neighborhood, it is quite a hot topic, and I think it will spread out to also the people with MS who are not following everything about MS. I also think with this survey, that was the first step, because I never thought there would be 93 people filling in this thing. Also, so much people who are not believing in the concept. So I think we can, as the MS Society, we can also do a project with it. I think there are a lot of opportunities. I'm not sure how it is in other countries. I don't know if someone can tell me something about that.
Yeah, let's maybe indeed leave everyone to think about that. Meanwhile, we could maybe give it the word to Melika, because you raised your hand.
Yes. Hello, everyone, and thanks for organizing this meeting. I'm actually thinking, okay, first of all, I have to note that I am a researcher working on evaluating AIs, And I think for with respect to this question, I would think it's better maybe to increase the awareness of using AIs, because, yeah, as I mentioned, as we are working, as our team is working evaluations, the AI outputs. First of all, we have to increase the awareness that you shouldn't, I would say, restrict yourself to one AI, to one LLMs actually, like, for example, to not restrict yourself to GPT answers or like Gemini answers or like Llama answers or these kind of LLMs models, and also to get better answers and outputs. I would say it's always better to put more data. For example, I'm also an MS patient, and I also recently changed my treatment from fingolimod to Kesimpta, and I was really worried within this transition. So what I also myself did was, of course, using AI a lot because it's also my main subject of project as well. So what I did was that instead of just asking one question, that is it good to change the treatment from changing the treatment from fingolimod to Kesimpta, I provide a lot of information, my age, my for example weight, or my for example, for how long I am having the MS disease, or how was my where did I live, and how is my, I don't know, like my hormones, to just give more data to LLMs to get better outputs actually. So if I would say, if a person gets an output that it's not a good output that she or he expect from LLM, it's because they, like, I would say it's more the option that they don't know how to ask their questions from LLMs. Because with respect to one question, it's better to always ask a lot of other questions as well, to see from to see one thing from different perspectives. For example, if you say Kesimpta is good, why are you saying that? Or for example, what are the reasons? Or for example, if you say that this reason is this, what are the like outputs for these ones? You know what I mean? It's just asking a lot of different questions from LLMs to get the better results out of it, and then brainstorm the whole output that you get actually. And increasing this awareness is actually probably help patients to trust more the outputs. You know what I mean? I hope you can understand.
And do you think there can be a role for the MS nurse to explore the whole thing together with people with MS who are not familiar with using AI? Because someone has to learn it to you actually, and to give the tips that you say, like give more data, check everything, yeah, like things like that. Or also give reliable sources, that it is not searching on the whole internet.
Yes, indeed, that is also a very important thing, because of course AI can check an output from all of the websites, which most of them are not good enough, I would say. So it's also better to always check the links that AI provided. So check yourself from which link that this information comes from. But with respect to the question, I'm hesitating because for my experience, whenever I went to nurse or my doctor and mentioned that, okay, from GPT, I got this output, they were like, don't trust GPT. And I was like, okay. So yeah, I think they also have this thing that they want to say to patient to not use AI a lot.
But that is just what the sessions in ECTRIMS and in the international MS nurse session was about. That in the future, I think they will learn to the MS nurses how to use it and how to use it for themselves, for their documents and the patient documents, but also together with the patients. to give better information and more personalized. Yeah.
In
I
that
would say-
regard, I think it would be interesting maybe to also hear the perspective of Valeria, because she is a MS neurologist also herself. So I'm actually wondering what she has to say about that. Would you allow a patient to?
So thank you, Malika, for sharing your input and also your excellent talk. I was wondering, Malika, what pushed you to go and look information on a chatbot, and whether which one did you use? You said perhaps ChatGPT is not the best one, so whether you were using open evidence or other kinds of chatbots. In general, as a MS neurologist, I'm not against AI, I wouldn't be here, obviously, but sometimes patients can malinterpret what, you're obviously very well educated and you work with AI, so you know what to click and where to look and you're top, but obviously the patients can come from every kind of background. And so I was reading that article on Nature about LLMs and how in the UK they did a large study. I'm sure many of you read about it, that they gave 10 clinical scenarios, and patients were talking to these chatbots about these scenarios. And then they wanted to check whether the suggestion given by the chatbot was the correct one. And they saw that there were a lot of different results. So for example, subarachnoid hemorrhage, it was the same scenario presented by different patients to the same chatbot, gave different results, because maybe the patient gave just some information, not all of them. The patient didn't understand properly what he had to do. So some patient would stay at home despite the subarachnoid hemorrhages. Some would go to the A&E, which was what they needed to do, so there can be some malcommunication with a chatbot sometimes, if you insist on a symptom or not. And so then that can be dangerous sometimes. Sometimes it's extremely useful. I have had health issues and I've asked chatbots to help me, but perhaps as a doctor, I can a little bit direct the conversation in some way. But I've seen some friends, peers, sometimes patients that sometimes malinterpret, and so then I'm afraid that they do something that it's not good for their health. And so I think in general it's because we're a bit worried. It's not because we don't want, at least for myself, I don't want patients to use it. It would help me have less maybe emails asking not stupid questions, but very simple questions. I had a patient asking me if she could get her hair removed from her legs, after starting Kesimpta. It was so stupid. Yes, obviously you can. And if there was a bot that he could just write at midnight on a Saturday, can I go, tomorrow to get my hair removed? And it said yes. It would be an email less to me that I have to answer. So I don't know, what do you think about this?
I have an idea. Actually, we have similar issue, but my subject is not about, of course, MS patients or these kind of stuff. But I would say, actually, for our students, we ask them to ask LLMs for these simple answers, for hair removal, please ask GPT to answer you instead of emailing us for this. But on the other hand, I'm not mentioning that GPT is not good, but what I'm saying is that do not restricted yourself to one LLM. If you are doing deep search, if you are using thinking LLM, thinking tool, actually, please do it using Gemini as well. Please using GPT as well. Try different LLMs to investigate and explore yourself from the results. You know what I mean? And of course, I'm also mentioning what I'm also doing is that, of course, I'm also searching a lot about different treatments, and I do consider it by myself, and at the end I will make my decisions with respect to what my doctor said, because of course LLMs are not a substitution from humans. It should be approved by humans as well. Within our research, we always do the same thing. For example, we use LLM in our studies, but at the end, we also, as human, we evaluate them as well. So we shouldn't restrict us to LLMs only, but we can ask for a lot of helps and to understand from different perspectives. But at the end, of course, it's the doctor that who make that decision. And about the MRIs, I would also say I could understand the whole algorithm that they use. It's like very efficient. I think you also know that. Yes, of course, I think it's better than human as well, but it's always for evaluating them as well. I also provide my MRIs to, for example, GPT and ask to, what it thinks. Also, I have to provide my blood test as well and also other things about myself as well to get a better output. But at the end, it's always my doctor who decide, you know what I mean? It's just for extra information that you could see from different perspectives to your case, I would say. But yeah, I'm not MS, how do you say, MS expert? But, sorry.
Pete, please.
Yeah, it's such a nice discussion. Thank you so much. It makes me think, of course, of 15, 20 years ago, everybody came to the hospital or came to the neurologist or the MS nurse and went first to Dr. Google. And now it's artificial intelligence. So I hope so much that it's better now, the output. But I think there is really, like Jochen already mentioned, a role for the MS nurse. I think you have to ask the right question. And you have to provide the right information, and probably that is so important to have a good output, I think. And maybe in the future we have to educate the nurses in that direction also. So thank you for the information.
First, of course, to maximize the benefits, but also to protect the patients, because I think I think it's like a delicate balance. I think it's very tempting to just throw everything out there because you just, of course, want an as accurate as possible prediction for your specific case. But I think it's good that people are also aware of the implications of what is being done with your data when you upload it, or what is. So I think it goes farther than that. Yeah. And maybe, I don't know whether you agree, but I think it's a lot about education, like bidirectionally, so that you educate patients about what it can be for them, what it can mean in their care trajectory, caregivers to make sure that they are indeed that kind of funnel from the research towards really clinical applicability, and also just for us developers to know what patients need.
Yes, indeed. And Valeria, I understand your concerns because, of course, in the MS community, we have people of all kind of education levels, but we also have often the cognitive impairments who is also having an impact. But as an advantage between Dr. Google and AI, if you do it well, it adapts on the person who uses it. Because if you want that, they remember things about you, your cognition level, or your knowledge about a topic. And I think that is very strong. Because I don't know a lot about AI, but I asked learn me the basics about this, and now I can follow the discussion, so that's very good. And if a patient doesn't know a lot about his disease, it can really adapt a lot more than just Google if you use that.
Nice. Well, I think it's only fair maybe to have Joke have the last words on this discussion as she started it.
Well, I have a small question.
Yeah, go ahead.
Because I see there are some, and I hear there are some people with MS also following this. do you use already AI for managing your MS? And what are your experiences with that? Like Melika, we heard already that you use that to compare medications, to analyze MRIs and lab tests and things.
By the way, if people do not feel comfortable in sharing that
Yes, it's
information
just an
or
open
something, then of
question.
course we can also do that afterwards. But okay, but as we
I don't see directly. No, it's no problem. I was just curious.
Yeah, but I think Joke, the thing that we can conclude is that you kind of opened the playground and opened the discussion on the topic, and that is, I think, the most important. And people that want to engage in it can. And I think it's something that we as a community also would like to learn from, so that we know and that we keep up to speed with what, or in touch rather with what the patients with MS actually need. So I can just only say thank you again and applaud you for your great presentation. I also think it was a really great discussion afterwards. Just for practicalities, I would like to ask, I'm just sharing a Google Forms in the chat. You can also find it on the iaims.org/events on Joke's different specific subpage. There is a small Google Forms. It's not very exhaustive. I think it might take only 2 minutes to fill in, but maybe you can give some thoughts about how you think this went, what we can improve in future journal clubs. Maybe you have suggestions for other speakers in the future, and then we can keep this discussion alive every month in our journal club. Okay, so without further ado, then I think we can close the session here. So maybe a big thanks again for Joke. Thank you so much.
I want to thank you all for your interest of all different angles of AI and MS interest. And I really want to thank you for listening and for discussing.
All right. Thank you, Joke. Thanks, everyone.
Thank you.
Have a great weekend.
Bye.
Bye.
Enjoy
Have a
the
nice
weekend.
weekend.
Bye-bye.